Hi, everybody. Good morning or good afternoon, depending on where you are. Let's just wait a couple of minutes for a few attendees to trickle in. We had several people that were signed up. Okay, let's get started, everybody. Thank you for joining us today, whether it's your morning or afternoon or late night in Asia. We greatly appreciate you being here. My name is Rob Haak. I'm the FiberShield product manager at PureAir Filtration, and today we're covering antiviral products for indoor air quality. About PureAir Filtration, the company started in 2004 and is highly focused on gas phase filtration. You'll see why that's important. I say gas phase filtration because we're really focused on tiny particles, uh, atomic level, microscopic, nanometer level particles. Virus sizes are incredibly important. The SARS virus right now that we're all worried about is 120 nanometers. Let's focus on IEQ prior to SARS. Historically, we only focused on particulate and gas pollution, very little focus on antimicrobial quality. And the microbes were only concerned in hospitals and what have you. These are some typical products that you've seen with dust filtration on the left, gas filtration in the center, and then very large air movers and air handling units on the outside of buildings, moving lots of air, fresh air into the hospital or indoor air quality environment. Some typical applications you would see are high density offices with many potentially companies working together, but certainly lots of people working together in a WeWork type of environment. But we've all been in our own offices and we've seen lots and lots of people, conference rooms and what have you, where there's lots of people breathing the same air. This is the way society's been working for a couple of 100 years now in the industrial world. So more recently, microbials have become a major factor. We've seen lots of plastic and plexiglass going up in your banks, your grocery stores, everywhere that you go, including restaurants, but it's more increasingly occurring just in the normal workplace where your everyday workers come in and work in an office, not just a hospital, but it could also be a factory, what have you. The virus of concern most recently is the SARS-CoV-2, which is the virus that causes COVID-19. But we've seen in the past talk about SARS, MERS, even the flu, other common microbials that occur throughout a year. The most recent one has everybody concerned, and rightfully so. But these types of activities have been going on for as long as the industrial world has been working together. As you recall, there was the Spanish flu of 1918, the Hong Kong flu in the 60s, several types of viruses and bacteria like this occur occasionally. We believe that once we get past this SARS-CoV-2 environment, we'll be seeing potentially more antimicrobial activity in offices and companies throughout the world. And that's one of the reasons we're having this webinar today, to discuss some of the solutions that we've developed. Let's talk very briefly about what ASHRAE has recommended for HVAC modifications. Central HVAC, for more outside air to come in and flush away the aerosolized microbes. You'll find that that's an increasingly common theme here at PureAir, but also in the indoor air quality world, that moving air through the rooms, through the buildings where the people are, and getting more air changes per hour, and that air flushed through filtration systems is really the way to keep the people safe that are in the buildings that we're trying to protect. UV light has a place in this as well. UV light has been proven to effectively eliminate many microbes, or at least help eliminate them. And then implementation of higher efficiency particulate filters to remove those aerosolized microbes. ASHRAE recommendations for their comments on traditional filtration, the aerosols that we've talked about and you hear in the news quite often now, are reduced by high efficiency particulate filtration, HEPA and the like. At this point, HEPA seems to be providing the greatest benefit. And it's easy to retrofit these systems into existing HVAC applications. The highest efficiency available right now is MERV 14, generally at a cost point, and that's what we like to see, and that's what ASHRAE is recommending. So there's 4 alternate filtration technologies that ASHRAE has talked about. Electronic air filters, or sometimes you'll just see the acronym ESP, ultraviolet light, bipolar ionization, and ozone. We actually see ozone more common in Asia, but we'll cover each of these very quickly. So electronic air filters provide a wide variety of electrically connected air cleaning devices designed to remove particles from air streams. This is a common device. We've seen these deployed more and more in the past 20 years. They do require maintenance, they do require power, so there is some downside to that, but we do know that they do work to a certain degree. The overall effectiveness of reducing the particle concentrations depends on several factors: the removal efficiency, the airflow, the size and number of the particles, which we're hearing a lot more about lately in terms of the aerosolized particles, the location of the filter in the system, whether it's at the beginning or the end or the middle or all three, and then maintenance and cleanliness of the filter components. I think we all have experience with filters in general, whether it's in your air conditioner or in your car. Filters are not changed as often as they should be, and that's one of the areas that I think will come out of this SARS-CoV-2 era is that people will realize that we need to be changing our filters much more often. Ultraviolet energy is certainly has an application here. We know for sure, particularly UVC in the far range of the UV spectrum, does have an inactivating capability of microorganisms. This has been known for decades. If you remember, probably most people's first exposure to this is in a barber shop or hair salon where UV light is used to clean the combs and scissors and what have you. But certainly there's applications where UV energy is used in the HVAC system. And there's certainly a place for that. And ASHRAE is looking at it, particularly in the ducts here. Typically these systems are designed for 500 feet per minute or even more. The irradiance zone, meaning where the UV light is and the air has to pass through that, is approximately 2 feet, although we've seen some that are growing now in size. And the microbes need to be in that irradiance zone for at least a quarter of a second. And again, that's at least. And it seems that it's probably more like a half a second now because the air streams are quite high. In the upper air, we see UV systems in occupied spaces 7 feet or higher, roughly 2.2 meters and higher. These are good when there's no mechanical ventilation available or limited ventilation available. And these might be where, particularly where there's lots of people involved in a room where it's hard to move the air. ASHRAE is suggesting that we put some of these in the facility. And of course, there's portable models which are coming out. These are not for occupied spaces, by the way, where humans would be. However, they could be moved in during the evening, turned on, and then taken away in the morning before people come in to work or into that hospital room or into that school. Bipolar ionization and plasma is the third area where ASHRAE is making recommendations here. It's reactive oxygen species based, and it's become a lot more common recently. However, the data from academic research is not yet common here. We don't know for sure what's going on, how safe these systems are over extended periods of use. Nonetheless, there does seem to be some use here, and more companies are starting to put out products like this. One factor here, which we'll talk about in a second when we get to the ozone, is that we know that these bipolar ionization and plasma systems can emit high levels of ozone. And we have to be very careful with that because it's not healthy for human ingestion of too much ozone, and nor is it good for the environment. So finally, the fourth ASHRAE recommendation is to look at ozone as a possibility here. Ozone generators are used, as I said earlier, more commonly in Asia, although I think that the trend is downward in this regard. It had been more popular in the past 10 to 15 years, but we're seeing more people go to just standard filtration type activities. And we find that these ozone generators should not be used in occupied spaces because it's harmful to humans over time. And as we mentioned, it's certainly not good for the environment. Now, one of the primary reasons for today's webinar is to talk about our PureAir Filtration's antimicrobial products. We have 2 new products that are available immediately to be installed in any HVAC system, and we'll cover them in detail now. The first is Microbe-sorb, and the second is FiberShield. So Microbe-sorb. This product is based on our time-tested permanganate-based product, potassium permanganate. And here is a sample. I have a jar similar here. If you're at all involved in the gas phase filtration environment, then you're used to seeing this kind of magenta colored product. We have specially formulated Microbe-sorb based on a proprietary formulation that has its foundation in our PureAir 12 product, which we've had in our catalog for several years. We've tweaked it through R&D to come up with this very highly aggressively antimicrobial product that can be put into a bed inside of a filtration system easily and very cost effectively. The typical product size, if you can see, I'll put this up to the camera. The sphere size is about 3 millimeters, between 3 and 4 millimeters. It's an alumina-based product impregnated with the proprietary formulation of permanganate. And we know through decades of research that the product is highly antimicrobial, and as the air passes through the bed of permanganate, any viruses, bacteria, fungi are deactivated. The product can be used in very standard HVAC applications, such as put inside of these types of filters, which everybody's familiar with. Most people we see are putting it into a 1-inch bed inside the filter, although some are using 2-inch and beyond. Typically, the PureAir filtration, gas phase filtration products have enormous beds of this media that are filtering the air. And as I alluded to at the beginning of the presentation, we're gas phase specialists, so we're quite used to removing atomic level molecules and atoms from the airflow stream, and removing bacteria and viruses that are larger diameter is rather easy for these types of products. So we had this Microbe-sorb tested using the world standard is an ASTM E2149 standard. We had this done at a lab in China, and it came back. This was for H1N1. They were not equipped to test for SARS-CoV-2, but we found that it's greater than 99.83% effectiveness at inactivating the H1N1. The Waterloo Filtration Institute has certified this product and the testing procedures in the labs that we've used to test them. And here's that certificate. The second product I'd like to review is FiberShield. FiberShield is a brand new product that we released only a few months ago. And it's an antimicrobial fiber that can be put into an HVAC system immediately. Here's a sample of it right here. You can see it's quite thin, 34 grams per square meter of this product. We've developed this product jointly with Noble Biomaterials. That's a world expert in the nanofiber market and nanomaterials market. It's the only fiber of its kind and the only product that can be put into any particulate filter immediately and provide antimicrobial effect instantly upon installation. That's what it looks like. It's an incredibly strong product. It's nylon 6/6, non-woven, spun-bound nanofiber. We use the Noble Ionic Plus silver nanoparticle technology is impregnated into these fibers during the manufacturing process of the fibers themselves. So this is not a coating, but the silver is embedded into the nanofibers. It's the only type of product available on the market right now. And again, it's ready and can be installed immediately. Most of our customers are putting the fiber in two different ways, pleating it into a standard pleat like the one on the left, and then inserting it into regular 24-inch by 24-inch or whatever size filter, and then simply installing it into the HVAC system. We should note that the FiberShield product in no way is meant to be a particulate filter. At best, it has a MERV 4 rating. However, it's incredibly aggressively antimicrobial. We tested this product with the global standard for antiviral, antimicrobial material fabric test, which is the ISO 18184, which was recently updated in 2019. And that fiber was tested against several different viruses and bacteria. In this case, we were able to test directly with SARS-CoV-2, and the results came back at 99.89% effectiveness. We tested several other viruses, including H1N1 and common bacteria, as well as fungi. The nylon 6/6 is a fantastic product in that it can handle almost anything that can be thrown at it from a physical standpoint. It lasts a long time compared to polyester and other similar products that it competes against in terms of just the fabric itself. But once it's impregnated with the silver nanoparticles, it's incredibly antiviral and antimicrobial. Now, the yellow area here, if you can see, this is the area that would be in between the fibers. In between the fibers, the silver ions are released and form a barrier in between the fibers themselves, so that the virus does not have to touch a fiber. The virus just has to pass through the fiber shield, and it will be deactivated by the silver ions that are there. The research in silver antimicrobial capability is ongoing throughout the world, but it's been well understood for more than 20 years that silver is highly antimicrobial and extremely aggressive at deactivating viruses and bacteria. There are researchers in every country who can be contacted and will convey that message easily. Here's some of our testing that we did. Again, this was with the SARS-CoV-2, the ISO 18184, as I said, was updated just earlier this year. This is the standard used for testing the antiviral capabilities of textiles. And here's the results. In this case, 99.14% for this batch, which is incredible. Here's again our certificate of compliance for this product by the Waterloo Filtration Institute. We have just a couple more photos of the FiberShield product. On the left is sort of an expanded view, and on the right is a SEM of the actual filaments. You can see that the fibers themselves are incredibly uniform. And again, in between these fibers here is the zone of inhibition where the silver ions are creating a fence, impermeable barrier for the microbes to pass through. Certainly the physical microbe will pass through there, but it will be completely deactivated. FiberShield rolls are available in these widths. We have a standard product of 61 centimeters, 76 centimeters, 152 centimeters, and the roll lengths are up to 4,000 yards. Volume pricing is available if you're interested in buying a lot, which many people are. Please contact me and we can discuss volume pricing. Quick summary, the FiberShield and Microbe-sorb by PureAir Filtration are available now. We can ship it tomorrow if it's necessary. These products add an immediate antimicrobial capability to any indoor air quality application. As I've shown you, the products are tested, they're proven, they're certified, using the most stringent and best international standards available at this time. Both of the products are easy to use, they're safe to handle, safe to dispose of, and extremely cost effective and easy to install immediately. Now, thank you for your attention. I greatly appreciate you attending today. If there's any questions, please type them in and I'll answer them. Otherwise, please feel free to email me, and I'm happy to send you a copy of this presentation if you're interested.